Medicare Open Enrollment will be from October 15th to December 7th this year. The process can be overwhelming, but the SHINE program is here to help. SHINE stands for Serving the Health Insurance Needs of Everyone. The program provides free, unbiased health insurance counseling for Medicare beneficiaries of all ages. Here's more on the program.
It's that time of year again for people with Medicare to have a chance to compare their coverage for next year. So everyone really has an opportunity to change the way they currently get their Medicare coverage. And for next year, or during this time period from October 15th through December 7th, is when you review your coverage for next year. And for this year, there are some changes in how you're going to be doing that.
The tool that we use, which is located on Medicare.gov, which we as SHINE counselors use, but is also available to the public to use, is undergone some changes and some updates. It's going to have a different look and feel to it this year. We have been working hard to familiarize ourselves with that so that we can be helpful to beneficiaries that are going to be using the tool this year.
In order to do what we call a personalized search, to be able to access their information and to be able to save their drug list, this year it will be required that people have a MyMedicare.gov account.
In addition, there are changes to some of the Medigap rules in the state. It's going to have an impact on folks' ability to select different choices in Medigap plans, and we want to be able to make sure people understand what those choices, what impact they may or may not have on them, and help them again to pick the best plan, the one that works best for them.
This is the time of year when people can make changes to their Medicare drug plan, if they have an HMO or PPO, Medicare Advantage type plan, or if they have Medigap, they can alternate between the type of coverage that they have. So it's very important, because as much as people may say, I'm happy with my current plan, but that plan could be changing. So if you don't check, you won't know, and you don't want to find out in January that your plan has changed and you might not have an option to change at that time.
The Metro West region actually covers 22 cities and towns. For folks in Needham, they can call the Needham Council on Aging directly and ask for an appointment. For anyone outside the town, or if they would prefer to go to a different town, we actually offer this service at any of the councils on aging, and people are free to go to any council on aging of their choice. They make a phone call, they ask for an appointment, and they usually get a confirmation call the business day before the appointment, just to remind them, and also remind them about what they need to bring to the appointment in order to make it an effective use of their time.
They should bring their Medicare card, a complete list of any prescription medications that they take. They should bring anything that they've received from their current plan and their current cards. It's also a good idea that people, if they do have a Medicare Advantage plan, like an HMO, or PPO, that they just check to make sure that their doctor is accepting that plan, or what other plans their doctor may accept if they decide to make a different choice.
We are here year-round. We usually do these announcements around open enrollment because this is our busiest time of year, but Medicare is not something that just stops and starts between October and December. We constantly have people going on Medicare for the first time, and we are here to help them with all of those decisions and getting all that information out to them. We have people that for whatever reason during the course of the year may need assistance with Medicare. We help with billing questions and with Medicare claims. We also, I think it's important for everyone to know, we do screening for folks for programs that outside of Medicare, they are public assistance programs at both the state and federal level. And everyone is welcome to come into us and be screened for those programs, which may help them with covering both their medication costs as well as some of their premium costs. So we encourage anyone who hasn't come in to see us before to come in for an introductory visit, see how we can help them, and then make it a point to come back and see us during every open enrollment.